Okay, my name is Mike Koehl. Have a lot to cover, so I'm going to move quickly and get going right away. A little bit of background. Let me provide a little bit of context. Over 50% of all injuries in sports can be classified as either a sprain, a strain, a rupture, or a break of a musculoskeletal tissue. And so, nutritional interventions, exercise interventions that are going to actually enhance collagen synthesis and strengthen these tissues can have a positive effect on injury rates. Now, the population I'm focused on is the baseball pitcher. And this is a scenario where the throwing arm is going to repeatedly incur high levels of repetitive stress. And so, professional baseball pitchers have a high medial ulnar collateral ligament injury rate. We're going to just call it the UCL. 15% of minor league pitchers and almost 25% of big league pitchers have had a UCL surgery, in fact. Now, the UCL is the primary restraint to repetitive valgus force, such as which the arm is going to routinely sustain. Azar et al. In 2000, they did cadaver research. They determined that the UCL has a load capacity of roughly 32 Newton meters. However, overhead pitching, actually the valgus force, that torque, will repeatedly be in excess of 100 Newton meters. And so the majority of baseball elbow injuries are in fact non-contact injuries to the throwing arm, and it's an accumulative trauma associated with repetitive pitching. And so we've seen the same trends now move into youth and high school athletes as well. In fact, 5% of youth pitchers have suffered a serious injury or will, and it'll require surgery and or even the retirement from baseball. Again, these are high school athletes. Now, Dr. James Andrews and Dr. Glenn Fleissig, and in a separate review of some statistical data, Olson et al. In 2006, they each pointed and determined that the risk factor with the strongest correlation to injury is the amount or the total volume of pitches thrown. As again, the UCL injury, this rupture of that ligament, it's not an acute injury due to exceeding the loading capacity of a tissue. It's again an accumulative trauma. So when comparing injured versus non-injured pitchers, the data would suggest that the injured pitchers pitch significantly more months per year, more games per year, innings per game, more pitches per game, more pitches per year, and more warm-up pitches typically before a game. These were the pitchers that were frequently starting pitchers. They pitched in more showcases. They pitched with higher velocity. These were the better pitchers. That's why they got used more. And they pitched more often, though, with arm pain and fatigue. Now, they used more anti-inflammatory drugs and ice to try to manage and prevent injury. Now, these findings led to pitch counts and an increased awareness in the baseball community, and yet UCL injuries are still in the climb. So let's discuss our nutritional intervention. We're going to address both athletes, pitchers that are trying to prevent injury, and those that are coming back even from a surgery. So the first concept we have to give consideration to is that of energy availability. Thomas, Erdman, and Burke in the 2016 position stand on nutrition and athletic performance. Again, this is the position of the Academy of Nutrition and Dietetics, Dietitians of Canada, and the American College of Sports Medicine. So first, they define energy availability as a concept which equates energy intake with requirements for optimal health and function, which that's going to include both cell recovery and cell regeneration. And more specifically, again, in this scenario, is collagen synthesis. And again, this is not just to be confused with energy balance, energy in, energy out, or calories in, calories out, which again is an important concept and applicable for weight management. But with either a competitive baseball pitcher or an injured athlete, especially someone who's perhaps coming back from a Tommy John surgery, a UCL repair, energy balance, and even more so energy availability is going to be a nuanced topic because they could be detraining. So they're recovering from this injury. They're not going to be able to practice most likely. They certainly can't compete. And if they're recovering, they're unable to do a lot of the things that they've done before. And so, without getting into any of the specifics as to what is indicated or contraindicated, it's important that some training be done immediately to not only avoid detraining, but to improve nutrient delivery to the recovering tissues. And so, although their energy intake may be somewhat down because they're not training and competing to the same capacity, in the case of a recovering athlete, or simply an athlete, again, trying to avoid a state of parasympathetic overreaching, or even worse yet, overtraining, we're talking if they're in a negative energy balance, much less a negative energy availability, that state, they're more likely to be in a negative muscle protein balance. And so they're in a chronic catabolic state. And so the rate of muscle protein breakdown, MPB, is actually exceeding the muscle protein synthesis rate, the MPS rate, which we'll get into a little bit more here. But Thomas et al., that 2016 position stand that I've already referenced, suggests that a negative energy availability status could elicit other issues and complications, such as endocrine, gastrointestinal, renal, neuropsychiatric, musculoskeletal, and cardiovascular dysfunction, none of which sounds like the ideal internal environment to promote and foster healing, much less prevent injury. Now, because tendons and ligaments, sinews as far as we're concerned, are in fact dynamic tissues, understanding how exercise and nutrition interventions increase the synthesis of collagen and improve tendon function can allow us to improve performance, prevent injury, and even accelerate return to play. Now, some research does suggest that both whey and leucine supplementation can improve tendon hypertrophy in response to mechanical loading, resistance training. In fact, data would suggest that using leucine-rich whey protein does activate the mTOR signaling pathway within sinews and does increase collagen synthesis in that specific tissue. In a randomized controlled trial, Farouk et al., 2014, they looked at the effects of resistance training in combination with either a whey protein or a placebo on tendon hypertrophy, and they determined that after a 12-week intervention, whey protein augments both muscle and tendon hypertrophy. And so it appears that the mechanism of action here is activation of that mTOR signaling pathway and its role in governing muscle protein synthesis. Now, with this in mind, any complete protein will activate the mTOR pathway as long as there's a sufficient load, 2 to 3 grams of leucine, and the full spectrum of essential amino acids. And so that adequate total daily protein intake is going to be vital for both injury prevention for a baseball pitcher and recovery coming back from a UCL, the aforementioned UCL injury. Now, Shaw et al. In 2017, they hypothesized that a nutritional and exercise intervention that increases collagen synthesis could have an impact on injury rates, and so they conducted a study to determine whether gelatin supplementation could increase collagen synthesis. Using 8 healthy male subjects with a randomized double-controlled crossover design, they actually used either 5 or 15 grams of vitamin C enriched gelatin or a placebo control. And they found that this supplementation strategy did increase circulating glycine, proline, hydroxyproline, and hydroxylysine, peaking approximately 1 hour after the supplement was given. Now, their findings suggest that gelatin, adding it to a resistance training program, does enhance collagen synthesis, and so it could play a vital role in injury prevention and tissue repair. In 2017, they did some follow-up studies as well, looking into the efficacy of collagen with vitamin C. And in this, again, Dr. Keith Barr determined that this nutritional intervention can improve collagen synthesis, and he does note that to date, there is no other nutritional intervention that is truly shown to be effective at promoting sinew hypertrophy. So that's significant. Now, vitamin C functions with connective tissues as an essential cofactor to promote the synthesis and secretion of procollagen. And so it's important that they include short, focused resistance training sessions under 10 minutes. Dr. Barr calls these connective tissue health sessions, and to do this in conjunction with a combination of collagen and vitamin C. Now, for this population, again, we're talking about a UCL injury prevention plan or recovery from a UCL injury. This pitcher is going to target the throwing arm. And so these exercises could be performed with a light weight, using a limited range of motion when needed, as indicated by the team physician or the physical therapist. And also the connective tissue health session should be performed either 6 hours before or after any other training, because there is a refractory period that needs to be considered. Following injury, pitchers should begin training as soon as possible. Training can consist of simple range of motion work and limited weight supported exercise, because the loading or the amplitude of the load itself is not that important when it comes to stimulating collagen production. Now, the training should again be 10 minutes or under with a 6-hour rest. And so that means that the athlete could train that body part up to 3 times in a day. Now, overall, we are going to prescribe a relatively high total daily protein intake. Roberts et al. In 2020 looked at resistance-trained athletes and determined that an optimal science current, what the evidence is supporting is a range of 1.8 to 2.7 grams of protein per kilogram of body weight. So that's a little bit higher than most people, I think, are familiar with. But they also would encourage them to spread it out over 5 doses a day when we're talking about total protein distribution. Beyond the direct effects that this will have on the muscle, the UCL will in fact benefit from the added muscle mass and strength and greater activation of that mTOR pathway that we discussed earlier. Barr does note that because blood flow to inactive sinews is limited, nutrient delivery to tendons following a exercise session is believed to be relatively low. And so rather than using this protocol as a post-workout recovery strategy, it's more effective that they use it as a nutritional intervention previous or prior to exercise. So with this in mind, we're advising 30 to 60 minutes before training that this athlete needs to consume either a collagen supplement or 15 grams of gelatin in conjunction with, we're going to say 100 to 200 milligrams of vitamin C, just as Gropper et al. In 2018 does state that this is the optimal dose to maximize the body pool of vitamin C because of the bioavailability or the absorption rates that we have to keep in mind. So that pretty much sums it up, and we hope you have a speedy recovery, or better yet, avoid injury in the first place. Thanks.